Hi, I'm Christine Lee. I'm a gastroenterologist at the Cleveland Clinic, director of endoscopy at Willoughby Hills Ambulatory Surgical Center. Irritable bowel syndrome is a complicated phenomenon where your intestinal tract can be really affected by a wide variety and long list of factors, from food to environment to stress. Your intestinal tract is organically normal, but physiologically, meaning how they function, is off the track. In certain situations, whether it's stress, certain foods, or a certain environment, it can cause quite a bit of havoc of symptoms that range widely. IBS symptoms vary widely from people to people. So most common symptoms tend to be queasy stomach, diarrhea, or it could be a sudden change in bowel habits, whether they swing from wide fluctuations from too frequent stools to too infrequent stools to just abdominal bloating and distension. And that has to do with the amount of gas built up in their intestinal tract that they're not able to eliminate. It just accumulates in like a balloon. They do feel like they're ballooning out. Some of the triggers for IBS is quite long. It could be food triggers to environmental triggers to medication or over-the-counter, including vitamin triggers, to travel triggers and stress levels. And sleep habits. Most common food triggers include dairy, cruciferous vegetables, or high fatty meals or high sugary meals, or wheat. That can be a common trigger for some people with IBS. There are so many factors that influences irritable bowel syndrome that most people don't even think about. I think the best medicine that's available today is exercise. Exercise is so helpful because it helps your circulatory system. It moves things around. So exercise is key. That would be the most important thing I would say for IBS management. And then sleep. So if you don't sleep well, your circadian rhythm is off its track, and then it can play havoc on your irritable bowel syndrome. Hydration. You want to make sure you do a good job at keeping yourself hydrated throughout the day. And then monitor your caffeine. In some people, a warm cup of coffee helps you go. In others, caffeine can actually cause constipation. One of the most common questions I'm asked, what is the most helpful treatment you would recommend to the IBS patient? And I always sidestep that because I think it can be harmful in the wrong scenario. And the reason why is no two irritable bowel syndrome patients are the same. They are uniquely different in their triggers, kind of like your fingerprint. So you have to really individually tailor the treatment options for the patient. So if your symptoms are problematic for you and interrupting your lifestyle, I really would encourage seeing a provider and making sure they have the full detail. You want to tell them everything. Things you don't even attribute to your IBS may be a huge influencer. So to get the best treatment specific for you and go through all of your specific history, your anatomy, your symptoms, and then get a specific tailored therapy for you.